My name is Gemma Dustin. I am a business owner and a remedial massage therapist and an Embark practitioner here in Cairns, which is in tropical North Queensland. Our predominant clientele that we have is we've got a lot of people that come to see us for remedial massage, and we specialise in a therapy called Embark technique. So this is a very specialised area that helps in addressing people with any acute or chronic muscle pain. It looks at releasing the muscles very gently by applying the gentle pressure to specific points, just to release a nice targeted muscle area. We also specialise in our clinic with doing pregnancy massage and also manual lymphatic drainage massage as well. So enough to keep us busy. I've got 4 amazing therapists that work with me, and they've just blown me away just with how well they do, how well the clients respond with them, and the results that each and every one of them are getting as well.
Tell us a little bit about your interest in scars, first of all.
The interest in scars, mine goes back a good 20 years ago. I used to be a registered nurse that worked in burns and plastic surgery. And we would see a lot of reconstructive plastic surgery that would come through to our clinic. So in addition, with quite extensive burns, and we're talking about up to 50%, 60% full thickness burns that would come to see us, and treating them in a very acute state, looking at pain management for them. But what I really enjoyed doing was the wound care. I really loved watching those wounds heal. And we would see a lot of, with the reconstructive plastic surgery, a lot of split skin grafts would come through. And the wound care that would be involved with that would be something I just have always felt very passionate about. I really enjoyed that part of the work as well. So my career has taken me from nursing to doing my own business with remedial massage. And scar therapy was something I didn't know existed until up a couple of years ago. And then seeing your course that you had advertised, I was very intrigued to want to come and just see how we could work with treating people with scars. And everyone has scars. Everyone, I'm sure, has got an element of scar tissue. It depends on the extent of the scar tissue, the attachment they have associated with that scar as well. And coming from a background where I would work with it so acutely, it was something that drew to my interest, because I would then be interested in wanting to see how we can help with people and getting the best recovery for them, even though they may have had the scars for many, many years, to be able to help get that better movement. If they still experience any pain with it as well, I was just very interested in adding it into my tool belt as an extra modality to use.
Going from nursing into manual therapy and specialising in your lovely Embark technique, and then going, the scar stuff. Are you able to integrate your Embark and your scar skills together, Gemma, now?
Yes, very much so. Very, very much so. So what we could always do with the massage or Embark with someone that may have presented with a scar, and they've had it for quite some time, we would still be able to get great results with it by releasing the muscles and the fascia around that area. What I learnt with your scar course is really how to hone in and isolate on that actual scar to get the more optimal results. That was very beneficial. Yeah,
that's great. That's great.
Works very well together.
Oh, thanks.
Very well.
I was going to say, so you were able to learn specific skills to treat scars online?
Yeah, definitely.
Definitely. Was that a surprise, or were you like, no, I'm sure this will happen?
I got more from it than what I expected, Christine. Just, I think it was something I always thought I had incorporated in with my therapies, but when I had done your course, it just then opened up a whole new Pandora's box, that to help people, with not just from treating that movement with the scar, but there's also attachments associated with it as well. The nutrition that you can have associated with wound healing, or if someone has just had surgery itself. And that's what we see in our clinic. We see a lot of people present to us for the manual lymphatic drainage massage, and we obviously don't do any initial scar work with them in that initial first 8 weeks. So we're wanting to definitely make sure that we can help assist with it, with that journey afterwards.
No, that's awesome. That's really cool. So you touched on a little bit there that this program's really just more than just the techniques. There is quite a lot in there, to be fair to people. So for you, what was the best part of the training?
I think adding another tool to my little toolkit. I didn't realize how much would have been involved with such a specialized area and how gentle your work is. So I'm very big on gentle approach with clients, and especially those people that have been through quite a lot of pain in the past and associated with an injury. The last thing they're wanting to feel is more pain. So it's just a beautiful approach, and that gentle approach just gives such amazing results. Yes, amazing
I'm
results.
always surprised even now.
Yeah. It's very rewarding. It's very rewarding. Yeah.
It's really rewarding. And like you say, they've been through enough already.
Yes.
The last thing they want is more pain.
Definitely. Definitely. So to come in and be able to help that person, you know, to get better movement, to help decrease their pain, but also to reconnect back in with that part of the body that they've just wanted to disassociate with for so long as well. It's very rewarding just as a therapist to help with that journey with that person, but also I'm sure for them it's almost life-changing for them as well. Again.
I personally think it's transformational, and
that's a real good word.
It just really appeals, you know, when we can actually transform people and give them that increased quality of life again.
Definitely.
Very profound. You did an amazing case study as well when you were during the journey of the SCAR program. Do you want to tell us a little bit about what that was like for you?
Yeah. It was probably something I was a bit worried about, thinking, am I going to be able to find someone to be able to do my case study for? And within the first week when I was doing my course, one of my clients had presented coming in for her regular treatment. I'm like, oh, of course. And I asked her and she said, I'd love to be able to be your model for this course. And she was quite appreciative with being offered. But what her presentation was, she had quite a multiple number of scars on her legs. And living up here in tropical North Queensland, we get a lot of exposure with the sun. She had a squamous cell carcinoma removed on one of her legs and what they call a halo skin graft that was placed around that area. So it left her with a nice circumference of about 5 centimetre distance on her leg. And then another one was a nice little 10 centimetre incision on her other leg. And for her, she had done quite a lot of work in massaging some vitamin E cream in during that healing phase. So by the time we were doing her scar therapy work, this was now 12 months down the track. And she had found during that time that she had built up a lot of tension from where the incisional scar was behind, like on the top part of her calf muscle. And she found that really started to build up a lot of tension behind her knee. So when doing a lot of the scar tissue work, it wasn't just necessarily about just creating changes and physical changes you could see with that scar. To begin with, it turned into a nice bright red colour by increasing the blood flow to it. But after a couple of days, that colour subsided and was able to fade a lot more. And there was a lot more, you could see it from the before and after photos. And then looking at doing her treatment a week later, again, you could see the fading with that scar. But for her, she noticed a big difference in the restriction that she felt behind her knee. And she didn't have that restriction there anymore. So she just was quite taken back with that. Yeah. And another area that we worked with for her, she had another incision just on the anterior part of her calf muscle. And she put it down to, again, restriction, but she was saying how it was quite limiting for her balance. And it, after we had done her treatment, it was able to really improve her dorsiflexion a lot more effectively. And she was able to have, she just found that her balance was improved, like quite dramatically after that treatment. Yeah, which is a big thing for her. She's only in her late 50s. So she's definitely too young to be having balance issues. So for her, it was just something that was transformational for her. Yeah, it really was. Yeah.
And I think, that when we have clients of that age who seem to be experiencing issues that we would normally associate with an older clientele, emotionally and mentally for that client, what does that mean to them? Suddenly the identity changes and all of these things. So
and they feel young again, Christine. They've got that spring back in their step. She's too young to feel, that she has to go down a pathway where she can't move effectively. And someone that's been mobilizing all the time and very active her whole life, to have that back again was just a game changer for her.
Sounds like a new lease of life, doesn't it?
It does. Very much so.
Congratulations on your
Thank you. Thank you.
Phenomenal work. Really, really, really.
Very exciting work. Very exciting, and making you want to do more. So yeah,
absolutely. So I'm going to ask you about what was the most challenging part of the program for you, Gemma?
I think the most challenging part, Christine, it was the initial stage of who am I going to ask to be my case study? And that was easily resolved just in that first week when I saw this client come through, and I had asked her, and just she didn't even have to think about it. She was like, yes, I'd love you to do a treatment with me.
That's so good. But in saying that, what I hear there was a bit of a leap of faith. So here's something. I'm in week 1 and I need to organize people for once I have these skills under my tool belt. Wow. So there's a little bit of a all in type attitude that needs to happen here with the very brave and wonderful scar therapists that come into the program. It is a very much like, we're going to plan this out and we're just going to do it. You just need to trust the process.
Yes.
You will be able to do this, I promise. Did you find that the support that you received during the transition in the course helpful to you?
Oh, very much so. There was a weekly Zoom meeting that we had with yourself and all of the other members of the group that were a part of this team. And it was great to hear their stories and experience with where they were at their journey. Some great results that everyone would be coming in again going, oh, wow, you just let me tell you about my story for the week. So very supportive. And like you gave the flexibility to attend if we wanted to. Obviously, if we weren't able to make it for the week, we had that option then with the Facebook group that we could just jump on and listen to your pre-recorded video that you had done with the group at that time. So it felt very supported the whole way.
Yeah. And how did you go with time, watching the videos, that type of thing, with running this busy practice and a family? How was that for you?
For me, I think it's about planning ahead. And, your course was for 7 weeks. And I thought, I'm going to just make this a priority for that time frame. I would listen to a lot of your videos in the car, traveling to and from work. So that's 40 minutes of a day for me. And that would be more than enough time to be able to catch up with what I needed to do for the week. So you're very good with how you selected with each weekly program to say, okay, this week we're going to be learning about this part of the course. And, I knew that I was up to date by finishing and listening to your pre-recorded videos by the end of that week. So knew what to expect with it. And it was easy. It was very easy by the time just listening to the car. If there's anything I wanted to go back and look at, then I knew where to go and just see how you were doing your treatments a little bit more closely that way.
Yeah. No, that's great. And that's really brilliant feedback for other therapists, because time can be a block for some people, which is, and I'm so glad you said about the planning, because week 1, we plan. How are you going to do this? Yeah, let's look at your time. let's look at your schedules, let's just get some things in place.
Yeah, I think we've all been there where we've just left things to the last minute and you're like, oh, I just need to just try and compact everything in together.
Yeah.
But one thing I've certainly learnt from experience is just to plan ahead, and even if it's just a small little bit each day, it just adds up by the end of the week. Yeah.
Absolutely, absolutely. And I completely agree. Completely agree.
My mother will be very proud to hear us say that, Christine.
Yes,
They're saying to me, get organised.
So I guess the online delivery format for you doesn't really sound like it was a huge problem. How did you find it?
I found it very organised, and I liked how you structured it to release each week by week. So you were just focusing on that particular part of the program each week. So for me, it was rest assured, I'd be like, okay, this is all I need to do for this week. And it was very straightforward to sit down, watch the video, and or listen to them in the car and just enjoy the journey, listening to the feedback on the clients that you were treating at the time on the video, and to see the changes. That's what was really remarkable too.
I loved in those Zooms, people coming with their results and the feedback.
Yeah.
That was really cool.
Yes.
And people asking really interesting questions. It's pretty cool stuff.
Very much so.
So what was your biggest takeaway
from the course? My biggest takeaway, I think, again, just that gentle approach with it. Like a lot of people have that mindset with scar therapy, it has to, because they can go deep. And you used a really lovely reference, if I can suggest, with the iceberg, and how we only see the peak of the iceberg with our scars. The most of that is built and up underneath the skin. So we have that mindset, it has to be a very deep pressure to get the movement of that scar and better movement with the fascia and the muscles around it. Whereas with what I've taken from your course, that light pressure is just unbelievably effective. And the results, again, just incredible. So that's my biggest takeaway. And I've really enjoyed that aspect with it, because we do a lot of light pressure with our clinic. So again, another great little tool to add to our toolkit.
So good. And I'm so happy it aligns so well
Very much so.
What you have going on, with the MLD and the Emmet and everything. I guess it helps with the Emmet stuff as well, that you don't have to use lots of oil to do this scar therapy work.
No, not at all.
That's an extra plus as well.
Because not everyone likes oil being used, Christine. Yeah.
No,
so
personally, I'm not an oil fan. So I really enjoy modalities that don't use oils.
Yes.
MLD,
yes,
especially, yes. all of that stuff, and the Emmet too. So
awesome.
Yeah, it's I think it aligns really well with it. So yeah, really cool. Anything you want to say about the course, or would you recommend it to other therapists? Or
I would definitely recommend it to other therapists. It's more than I expected I got from the course. So again, you can use it, as we were saying before, everyone has got a little scar, whether it depends on being big, small, visible or not visible. It's something that I would definitely recommend for a lot of people to do. Yeah. And thank you for a great course. It was I really enjoyed doing it. Yeah.
So cool. Coming from someone who is in the education of body workers and massage therapists, and it actually means loads. So thank you, Gemma, so much.
Oh, you're welcome. Yeah. We can always learn something new, Christine. Always. There's always something new to add to our little toolkit. And this was one for me. I just really enjoyed it. Coming from my background, then seeing it, how we can look at recovery phase for a lot of clients.
Yeah.
Very beneficial.
So looking at the pre and post-operative care that we can deliver, and how well suited body workers actually are to that.
Yes.
yeah, that support systems that we can get. So yeah,
Awesome. Yeah.
so much, Gemma.
Thank you,
Um,
Christine. Yeah.